when the heart fails, can you make it pump again?
Yeah, so heart failure doesn't mean that heart has stopped, because that failure word means that people think that it doesn't work or something. So when heart function goes down, we call it as heart failure. So heart, the only main important function of heart is to pump. Okay, so when the heart function goes down, it's called heart failure, and patient will develop breathing problem, or they will have a swelling of legs when heart failure happens. And there we treat with medications. Now we have a lot of medications which can improve these heart failure symptoms, reduce the mortality, increase the survival also in heart failure patients. People beyond were not responding to that, they can undergo other treatments. We have something called CRT. We place a device, increase heart function, and then even we can go to the extreme of transplant also, heart transplant.
So there's always a lot of technological advances in cardiology. What are the newer treatment that is coming up in the pipeline, or you're doing it already?
Earlier, we had some kind of blockages which were very challenging, blockages in the heart vessels. Like conventional usual angioplasty where you place a stent and open the blood vessel. Sometimes it was not possible because of the comorbidities of the patient. Patient may be elderly, or they will have a diabetes, or they may have a lung problem, kidney problem. Now with the advancement in the technologies, what are irrespective of the age and what are comorbidities they have, we can do something called CHIP, chip angioplasty. It's a complex angioplasty with newer hardwares, even for any challenging blocks. It may be a person who was deemed unfit for bypass surgery also. So then we can do this chip where we, if they even calcified blocks, we may do some drilling, and then or we may use a laser angioplasty, and we may use sound waves. It's called lithotripsy. Just like we break the kidney stones, we may create fractures in the calcium, which is deposited in the coronary artery. Because usually it is like, there is some difference in laying road in a level ground and in a part which has a lot of rocks. So sometimes the blockages may be rock hard also, like very concrete, like a wall. So we have used various techniques, and then so that the stent is expanded. And then we do scanning inside the blood vessel also, so that we can see how much the stent has expanded. Then and so that patient will not come back with the restenosis, that we are reducing the chance, increasing the outcomes. And other treatments like valve treatment, like earlier it was all open heart surgery for replacing the valve. Heart has 4 valves. Now all the 4 valves can be treated without going for open heart surgery. So that's called catheter treatment. So catheter valve replacement for the aortic valve. Then we have that's called TAVR, TAVR procedure. And even for mitral valve, then we have MitraClip, where the valve, leakage valve doesn't close. That means blood goes and returns back. So those procedures we have. And pacemaker is another device which is placed to increase the heart rate. Whenever heart rate goes down beyond 40 heart rate, people may collapse also. So this time it will increase heart rate. That is called pacemaker. And we have advancement in that. Earlier it used to come with a lead, that is a wire which is placed. So pacemaker will be placed under the skin below the clavicle, and then there will be a wire which will be connected to the heart. So now we have a small pill-like pacemaker. It's called leadless, that is wireless pacemaker, which can be placed through catheter, just like undergoing angiography or angioplasty. We can just go and then keep it inside the heart and then come.
It's seen on X-ray?
Yeah, no, it will be seen very minimally, but it's all by Bluetooth. What we do some interrogation pacemaker like that. In X-ray, the conventional pacemaker will be seen in X-ray. But this newer pacemaker will not be seen. It's very difficult to identify.
I see.
And many other treatments. So many other diseases for earlier, which were people have to undergo incision, surgery, scar. Now a lot of catheter treatments have come. So all kind of diseases now we'll be able to treat. Whether the patient is complex because of age, or the hemodynamics, what we say, blood pressure is low, heart function is low, something, or the blockage is complex. So whatever is that, we'll be able to manage now with the current advancement in technologies.
As a cardiologist, what are the things that you will add in your patient?
Within the category of lifestyle modification, I would try to ask them to increase their consumption of fruits, vegetables, and then green leaves, whole foods, and plant-based diet. And I would also ask them to increase their sleep duration, increase their physical activity.
Super. What are the few things that you would avoid in a patient as a cardiologist?
So I will tell them to reduce salt intake. So sodium intake should be less than 2 grams per day. And I will tell them to avoid added sugars. I will tell them to avoid simple carbohydrates which have high glycemic index. I tell them to avoid foods which have high trans fatty acids. I will tell them to reduce foods which have saturated fats. And also I'll tell them to reduce their stress level. More importantly, I'll tell them to avoid active and passive smoking also.